You are listening to Preconceived, where we examine the preconceptions that shape how we view the world and the paradigms by which we live our lives. Hey everybody, I'm Zale Mednick, and welcome to another episode of Preconceived. As vaccine rollout is well on its way in many countries around the world, we can begin to consider a return to quote-unquote normal life in perhaps the not-too-distant future. But what does normal actually look like? After over a year of this pandemic, our lives have drastically changed. As we begin to look to post-pandemic life, is it realistic to think that things will simply go back to the way they were? Or has COVID changed the way we look at the world and the way we wish to live within it? Is there really such thing as a return to normal? How might introverts and extroverts respond differently to the reopening of society? And how can we all prepare ourselves for the changes that will inevitably come? I am joined today by Dr. Lauren Cook. Lauren is a therapist, keynote speaker, career coach, and author. She specializes in supporting people with their life transitions and the corresponding anxiety that often comes along with these changes. She's the creator of the Find Your Why, Know Your Way course, which helps millennials make efficient and effective life decisions with confidence. She is the author of 2 books, Name Your Story, How to Talk Openly About Mental Health, and The Sunny Side Up, Celebrating Happiness. Lauren, thanks so much for joining me.
Thanks so much for having me on, Zale. Good to be here today.
I'm excited to chat about life post-COVID. That sounds like a good thing, right?
I think it's an important topic, definitely. I mean, it's something that we are all going through actively. So I think this is right on point for today.
So what do you think are some of the biggest challenges that people are going to encounter as we re-engage in this idea, which we can talk about, of normal life?
Yeah, absolutely. I was just reading about it the other day that there's a lot of talk about, and they're even formalizing the term re-entry anxiety. And I think we're going to see a lot of that. I think there might be a little bit of a honeymoon phase of things starting up again and that initial excitement. But I think we're also going to see a lot of anxiety because essentially this past year, we've had an opportunity to avoid all the things that would normally bring us anxiety, right? Whether it's giving a presentation at work or going out on a first date at a bar or, going out to an event and meeting new people. All these things that would normally trigger an appropriate dose of some anxiety, we've lost total practice with that. So the threshold is much higher for our anxiety experience. I think we're going to see a lot of people feeling more nervous than maybe they would have even a year ago.
I like the way you phrase that, because I think a lot of people, when they think about COVID, they would think, well, I've been really anxious, and we know that there have been increases in psychiatric illnesses and mental health problems during COVID. So to hear you say there's going to be anxiety about the things that we maybe forget actually used to induce anxiety is a very honest and real perspective, because yeah, there's obviously been anxiety and mood issues associated with being locked down and not engaging in normal life. But it's easy to look and say, oh, I remember when things were perfect when we lived back in a year ago. But all those things that used to cause anxiety, you're right, it's been easier to retreat from those, right?
Exactly, exactly. So especially for folks who experience social anxiety, maybe folks who identify as introverts. I myself identify as an introvert, right? You tell somebody, hey, hang out at home and read books for a year. Some of us are like, okay, I can work with that. But to really re-engage at the same level that we were of going back into the office frequently, all these different things, we've lost practice with that. So I think for some folks especially, we're going to see that big spike up in anxiety. The good news is that with exposure work, what we always see is that anxiety spikes up, but as we go through the experiences, our anxiety does fall down, right? Like the more you practice something, the easier it becomes. So I think we're going to see this intense burst of anxiety as things really get back to normal. But then I think we'll see those social skills muscles get stronger again after a month or so. And I think people will find themselves getting back to their rhythms that feel good for them.
So when you're helping people and you're giving advice, is one of the things it sounds like saying maybe anticipate and expect that you're going to have some of that anxiety. And that's not a bad thing. That's okay. That's normal that you're going to be anxious re-engaging in more social activities. Be comforted, though, by the fact that the sooner you do that, and as you continue to do that, that anxiety will go back to hopefully the pre-COVID levels, and maybe maybe even better if you continue to work on yourself.
Exactly. Yeah. I'm such a fan of incorporating metaphor in my clinical work. And so I'm always sharing with my clients, jump off the metaphorical diving board, face the fear. There's a great pool waiting below you. You have to remember you can swim. I think the longer we stand on that diving board looking down, the scarier these things feel for us. So go to that meeting. Obviously, if you're vaccinated, feel safe to do so, but go to that meeting, go on that date, speak up at work, whatever it might look like for you, face the fear, and you're going to see that it gets easier with time.
You mentioned you're an introvert, and I will say I'm an introvert as well. So I guess we could use an extroverted perspective, but you work with a lot of people, so I'm sure you have that perspective too. But to me, yeah, this year, I know a lot of people have struggled, and we've all had our own individual struggles, some people more than others. And like you said, for me, the idea of being home more often, reading, watching movies, and kind of keeping to myself hasn't been the worst thing in the world. Whereas for other people, it's been really devastating and really tough for them.
Mhm.
So how do you navigate the differences that are intrinsic to people, of some being introverts, some extroverts, and different expectations as we reopen society?
Yeah, I love that question. And I really saw that in my work with my clients and on a larger scale too. In the beginning of the pandemic, especially for our extroverted folks, I think we really saw some increased depression happen because for those people who get their energy from others, having that taken away very suddenly, you see two things happen, right? You see hopelessness happen and you see helplessness happen, of feeling out of control in the environment. Those two things, recipe for feeling depressed, right? Whereas when you have some introverted folks, where again you're getting to be home more, those wishes of like, oh, I'd love a day at home, well, here you go, right? You see, for them it was okay, right? Especially if there's any anxiety, again, all those things that would normally trigger anxiety were no longer being exposed to. Now we're seeing like an opposite effect, right? As things are reopening again, extroverted people, again, they're feeling hopeful now, they're feeling more in control of their environment. So depression is lifting. But again, anxiety increasing for a lot of maybe our introverted folks who are really having to re-engage again those expectations of, hey, come to this family gathering or whatever it might be, right? We're seeing that pull more for introverted people now of like, oh, do I really have to? So what we get into in that space is you've got to figure out, how do you challenge yourself in those situations, but how do you also set boundaries at the same time in a way that your life feels like it's in accordance for you? It's a dance, right?
Setting boundaries is important. And like you said there, for the introvert, it will be challenging to do that. And at what point do you say, I've liked my solo time, I've liked how things have been, but I also acknowledge that maybe it isn't the healthiest long-term life solution to be as isolated as I've been, and that I need to start re-engaging in the world? How do you talk to people and say, yeah, that's good that you've had this time, and you can still have that time. You can still find ways to set limits, but at the same token, we also need to acknowledge the importance of putting yourself out in those anxiety inducing situations, and the importance of social connection that maybe you don't realize has been missing, that is important for you to re-engage with.
100%, 100%. And this is where I always come back to values work. Like, it's so important to know what you value, because that's going to help you long term, right? Because short term, a lot of times we reach for things that maybe aren't the most helpful for us long term, right? We may say, like, oh, let me just cancel all my plans. I don't want to see anybody. But long term, it's likely better for your mental health to, hey, spend time with your family if you have healthy relationships there. Hey, go see a friend, right? Whatever it may look like for you. So sometimes we really do have to challenge and stretch ourselves a little bit, so that long term we're feeling like, okay, if family and friends and relationships are key values for me, including as an introvert, then sometimes I've got to get a little uncomfy. And something that we really like to implement, fancy term for it is called distress tolerance. But the idea of it is getting comfortable being uncomfortable. A lot of us nowadays, we really don't like to experience any discomfort in our lives. And yet some of the really good things in our lives come from when we get a little uncomfy. So we got to lean into that, especially when it's in alignment with our values.
And how gradual, and obviously this is a tough question. This varies for every person, but I mean, most of us every week we've been spending every night at home kind of on our own or with whoever's in our household,
Mhm.
how gradually is it reasonable for people to kind of uptick their engagement in social activity? Is it reasonable to say for some people, and again, I know it varies, but is it reasonable for some people to say, listen, every Saturday night, yeah, I'm going to make an effort to actually go out and have plans, but the rest of the week I'm going to stay in? Or is that even too ambitious? How do people decide what is quick enough and what is a good pace?
I think people have to figure out what's right for them. There's no right or wrong answer here. And if anything, I think the pandemic has been such a gift in a way, in this one way, of really figuring out how you like to use your time. And no guilt and no shame in that. You know what I mean? Like I used to be so booked on my weekends, and now, Zale, I say, never again. You know, I really now I try and leave my weekends unscheduled, where at least I won't take work meetings. I'll schedule in social things, but I won't schedule any work during that time. And I find that really helps me avoid burnout, right? So people need to be aware of, like, okay, what are some things I'm looking forward to on my schedule, right? Whether it's having a family get together, or it's maybe going out and seeing a few friends, having a picnic, what have you, where I find myself looking forward to it, right? That's a big indicator. And two, if you're noticing that hangover of burnout of like, ooh, I'm dreading this, or I really don't have the energy for that, you don't have to guilt or shame yourself into doing that, right? There's a big difference between feeling guilt and burnout versus feeling like you're avoidantly fearful of something, right?
You've talked about this notion of tapping into your courage.
Mhm.
What does that mean to you? And does that, how can people implement that ideology into their lives as they do try and find that courage to embrace some of the unknowns and some of the anxiety provoking situations that they might be re-entering into?
I'm a huge advocate for courage because I really think it's the major change maker. You know, I would argue that actually when we make behavioral changes in our lives, that's when we see way more changes in our mental health than sometimes working on our mindset. I'm all for mindset shifts, but our brains are really smart and we can try and talk ourselves out of something all day. We can try and give ourselves that pep talk of just go, you can do it. No, you have to show yourself behaviorally that you can do it, because that's really I think, one of the only ways the brain starts to buy in of like, okay, maybe you can do that interview. I saw you do that, right? Maybe you can go and give that speech. I saw you do that, versus sitting at home telling yourself, I think I can. I think I can. You have to show yourself and give yourself the data. So when I talk about courage, I'm talking about behavioral action, right? Whether it's making that phone call, sending that email, going out, putting in 10 extra minutes at the gym, whatever it is for you that's going to challenge you and stretch you. 5 seconds of courage to just start that process. And it's like physics, right? That first initial bit of momentum feels really hard, and then it builds on itself and gets a little bit easier over time.
So really changing your behavior is more likely to change your mindset than saying, I'm going to change my mindset and then hoping your behavior changes. You really have to take those actions, even if they are small things that might feel big.
That's what I would argue. That's what I would argue.
Let's turn a bit to the extrovert's perspective, because there are probably more extroverts that listen to this as well. So there are some people, and I've already seen it in my daily life, and I'm in Toronto and we're pretty shut down still, but people getting excited about the reopening of things. And there are some people who are really excited about it, and they're making plans and making plans for the future when it's safe to do so. But is there a way for them to maybe temper their expectations, to realize that there are a lot of people who aren't necessarily as excited as them for a reopening, and not to take it personally, for example, or to be more aware that other people are going to come to terms with the reopening of society at a more gradual rate than perhaps they're ready and excited to do?
I think that is such an important question. I'm working with a client going through this as we speak. This is where I think leaning into empathy is everything, right? Because especially this past year when we have been isolated from others, we don't get as many opportunities necessarily to have empathy for someone else's lived experience because we're not always talking as much as we used to. I've seen a lot of social apathy, especially the past 6 months, where we're just not talking as much with other people, especially not those in our immediate circle. So we have to have empathy for someone else's lived experience, even if we can't necessarily connect to it or it's completely counter to how we feel about something. And this is where we can hold that both and mentality, right? Of, hey, I can have how I feel about it, my beliefs about it, and there can be room for how you feel about it as well. I think sometimes we really fall into these right or wrong labels of like how I feel is right, how you feel is wrong. And this is how we get more polarized, more divisive. If we're really going to come together and have these effective relationships, it's starting to lean into that empathy that someone else could feel differently, and that doesn't necessarily have to feel threatening.
Empathy is the perfect concept there, I think, to focus in on. Obviously, that's why you said it. You did. It's a great term because people, I think there will be a lot of judgment that we're at risk of on both sides. People who are saying that person's going nuts, they're really going out too much now. And I think there might be some judgment on the other side saying, why on earth wouldn't this person come to this big party? They've had months to be cooped up and do their own thing. Now it's time to re-engage. But that empathy, even if you don't understand it, just trying to understand it or trying to understand the perspective that they're coming from is going to be really valuable for that, as people just feel really differently about reopening.
Yeah. Well, and I love your point too about not personalizing it, right? Like it's not a personal attack if someone else chooses to go one way or the other. But I think it feels so easy for it to become personal, but also holding to, yes, we're seeing the behavior of someone, but there's so much happening underneath that surface that we don't see, right? Like we don't know what's going on in someone's mind. And I think a lot of us engage in some mind reading behaviors of, well, I know what's best for them, or I know what's going on with them, when we really don't, you know?
Mind reading, not a good idea, you're saying.
Not a good idea. And yet many of us, I'd say what I see most common, mind reading and fortune telling, predicting how something's going to go when we often just really don't know.
Tell me a bit more about that. What do you mean by the fortune telling aspect there?
Yeah, absolutely. Well, I mean, this is classic with anxiety, right? Is we try and predict the future. And this past year has been such an example of not being able to predict the future, right? And I think the reason why we often will engage in fortune telling is because with anxiety, we want control. And if we really sit with the reality that there are a lot of things in our life that aren't necessarily in our control, that can be really, really hard to sit with. And that's why I'm such a big proponent of what's called acceptance and commitment therapy, or ACT for short, because it's a no BS approach. It's like the reality is like there are things that are uncontrollable in our lives. Pain, struggle is a part of life. We can fight that and mentally exhaust ourselves and freak ourselves out, or we can acknowledge the reality of that and start to sit in the fact of our resilience of, okay, if hard times come upon my life, which let's be real, they will for each of our lives, I will be able to deal with it. I will endure through that. And coming at it from that lens, I think really helps alleviate people's anxiety because, hey, it is what it is, right? And you've got to know that you're resilient enough to get through it. I mean, for anyone listening to this podcast today, we've gotten through this past year one way or the other, and we've got to acknowledge that piece in it.
Absolutely. How do you anticipate, and again, you're not a fortune teller, you don't have a crystal ball, as you just said, but work life is obviously going to change. And one of the ways things I don't think are going to go back to normal, work probably isn't going to look like it did pre-COVID. There probably will be more tolerance and proponents of, yeah, you can be a little bit more independent because you seem to be functioning okay when you work from home, you got your job done. There's really no, you're crossing your fingers there. There's no telling. It's going to vary per organization and per person. But having said that, I imagine there's going to be changes still where there is an expectation that, yeah, offices will reopen and maybe it's fewer work days a week that you're expected to be there. How do you anticipate that being difficult for people, kind of moving from this real independence in how you do your job to losing some of that independence, still gaining social interaction and other things from it, but
Mhm.
losing your daily structure, which we've come to transition to?
Yeah, Zale, that's such an important question. And honestly, I see this being probably one of the most tricky parts of reentry because this is where people have such different feelings about it, right? You have some people who can't wait to get back in the office. They miss those social interactions. And you have a lot of other people that are like, you know what? I've really been loving the independence, right? I'm still effective with my job. I have a little bit more flexibility. I think the key here is some collaboration, right? Because so much of the time, I see companies operating from such a hierarchical lens where they're not necessarily asking their employees, hey, what's gone well for you, right? What would be most effective for your mental health, right? I think we need to include mental health as part of the narrative here. And if we can start giving the employee a little bit more control in the schedule potentially of asking, hey, do you want to be in the office? Is there a hybrid model that might work? I think we're going to see a lot of companies having just better overall mental health because I think it's going to be really hard if we do a full 180, right? Of like, okay, starting next month, 5 days back in the office.
That sounds like it would go well, right?
Right. Oh, yeah. Recipe for success. So I think it's going to be really tricky. And if anything, I hope that it brings up more of a collaborative model where the employee can share their experience of it. I think it's important.
Yeah, communication will be key, and it's just there's so much pontificating and thinking we can do about it, but we don't know how it's going to play out. And
Mhm.
I don't. I'm a doctor, so I work at clinics, so I haven't had to. I'm not going to have that same challenge as a lot of people. But speaking to some friends, I know that they're concerned about what it's going to look like because I think they've proven that they can do their jobs from home, and that independence will be lost. And even before COVID, there were certainly sentiments of there was a digital nomad movement where people were already kind of traveling a lot more and saying, I can do my job while I'm traveling, and companies being more open to that and saying, yeah, go ahead, that's fine, and new company styles. So I wonder how many companies will pivot to that, or how many companies will say, well, we really do want you on site, or we really want to build this family at an organization and this culture, and you really can't do that as effectively over Zoom. So I'm really curious to see how that plays out. And that's not going to be something we even know in the next year. That's going to probably be over the next decade, right?
I would so agree. I'm just as curious as you, Sale, to see how it plays out. And I think we're going to see a lot of employees really going for what works for them because I think there will be opportunities that cater to the type of work environment that the employee is looking for, perhaps more so than before of like, hey, here's the standard Monday through Friday, you're in the office 9 to 5 model. I think we're going to see a lot more variety and perhaps it will make the work environment more competitive in the sense of the employee is going to have some different options to go with.
That's a really great point. And the employers and the businesses might have to change their models to be more conducive to what people want. And I think when you say that, it sounds obvious because you're saying it so articulately that it's true. The market is going to have to adapt to what people want, essentially. So maybe people don't need to worry as much about that because it's a general sentiment amongst a lot of people that I
Mhm.
kind of don't mind how things have been from a work perspective the last while. So
Mhm.
companies are going to change their mantras based on that.
Yeah, yeah. We will see. We will see.
I want to talk about, sounds cheesy as I say it, but finding meaning in the coming year. And the
Mm.
reason I say that is there's been so much anticipation for a lot of people for this. I keep on calling it this reopening. I don't know what better term to use, so we'll just go with reopening. There's been so much anticipation about it. And as we've all been on lockdown for so long, I think a lot of us have been able to take some time and reassess what matters to us, reassess maybe some bigger goals that we have, some
Mhm.
things that we want to do, whether it's traveling or whether it's not even traveling, but just initiatives we want to do, whether it's career changes or projects we want to work on.
Mhm.
That can be overwhelming though when things reopen and you finally feel that pressure of, okay, well, now it's time for me to really put my money where my mouth is and act on those changes. How can you advise people on being able to go after their goals and act on some of the things they've been dreaming about, but maybe taking some of the pressure off of them to do all of that right away.
Yeah. I think we can be so impatient with ourselves, right? And I struggle with this myself, where we just feel like we need these almost instantaneous results. And it's such a process. And if anything, this past year, I think we've been forced to learn the notion of patience, right? And so tapping into that patience with our careers, with our relationships, with our goals, whatever that may look like for us, and knowing that the growth happens in the process, not in the end point. I think so many people are running for these end point achievements, and then they're disappointed when they don't feel fulfilled in that. And so really thinking about the process rather than the checkpoint, if you will, I think that's really, really important, that we slow down and get patient in the process. It's hard to do.
And as part of that, are there any ways when you're setting your goals that it's effective to set them so perhaps they are a bit less daunting so you can really look at the process more than focusing on that outcome?
Absolutely. I think you've got to break your goals down into the smallest bite-sized pieces it's possible. I work with a lot of college students, and they really struggle because they'll say, well, I've got to work on my thesis, or I've got to do a 20-page paper. I say, no, 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 let's focus on just writing the introduction, right? Like that's going to get the ball rolling. And, it's important to take it as small as you can. And the other piece too that I think is so, so huge, you have to find mentors. Like I'm such an advocate for reaching out, networking, connecting with people, right? I reached out to you, right? If I see somebody that interests me or I want to have a conversation with, you better believe I'm going to send a DM or an email, right? So it's so important with our goals that we are looking at people who are excelling with the things that we want to, and we start having these conversations, because I think a lot of people operate in their own little echo chambers. They're afraid to ask for help, when honestly it's such a sign of strength, I believe, to ask for help and to keep growing from other people.
Absolutely. Are there any trends you're seeing, and not a scientific question, but are there any trends you're seeing amongst some of the people you're working with, whether they're college age students or people who are a bit older, in terms of the things they're really looking to pivot in their lives when COVID is over? Are there certain trends that are emerging? Or is there a certain demographic that's saying, okay, I'm going to party hard, or now I'm going to go traveling for a year and make a really big life change?
Mhm. I love
Anything
that
you've
question.
noticed?
Yeah, a few different things I've noticed. Definitely people taking a very good hard look at their careers and what they're doing for a living and realizing, is this what I want to be doing in terms of how I spend my days? I mean, that's why I'm launching a course right now. It's called Find Your Why, Know Your Way. And it's all about helping people really make intentional values-based decisions about their careers. Because I mean, listen, we spend the majority of our time at our jobs, truly. So let's do something we actually love to do that brings us meaning and purpose, right? Money is not necessarily everything. You have to know what values to you, what matters most to you. And that's going to help life not just happen to you, because a lot of us are just going through the motions. I'm also seeing some major changes in relationship status. And what I mean by that is I'm seeing some people be a lot more intentional about dating, right? Maybe they've lived alone, they've been feeling lonely this past year, and they're like, you know what? It's time for me to be intentional about finding a partner. I'm not just going to wait for someone to fall into my lap. Other times we're seeing things like relationships end because people have had this year to really get reflective. So many of us, I should say, we're so busy we don't even have time to sit with our thoughts. This past year, we've been able to sit with some thoughts. And so I think we're going to see people take action from those thoughts this year.
In regards to relationships, again, a lot of these questions, they all vary on the person you're talking about. But when
Mhm.
you see people who are struggling with relationships, is there value in also saying to some people, listen, maybe things haven't gone so well in your relationship during COVID because this is an abnormal situation and that's not the relationship you really signed up for. You both don't really function super well in a relationship when you're locked together all the time. So
Mhm.
maybe give it some more time now that things are reopening, because you made it through that tough period. For some
Mhm.
people, I think they would say we learned things about each other that we didn't like and we weren't compatible. For other
Mhm.
people, though, maybe there's a brighter way to look at it that, yeah, you know what, you guys didn't do quarantine well together, but that doesn't mean that your relationship can't work in a world that looks more like the world that existed when you guys decided to get together in the first place.
Exactly. I think that's where it really boils down to, like, is it a values ideological challenge in the relationship? That's harder to work with, right? Like, there's no amount of logistics that will necessarily change that. But if it is a logistical challenge, yeah, I'm all for hanging in there. If a couple really values commitment in their relationship and it's the logistics that are getting in the way, see what happens, as we are going to hopefully get back to a little bit more of the normalcy that we had before. Yeah.
I like the term that you're using, values-based decisions. Do you see that there also being a potential risk of some people making decisions a bit impulsively that COVID has done? Because, well, I'm not wasting any more time now. I'm going after life. I'm not happy this moment, and I've spent too much time not living the life I want to live. So I'm going to make a drastic change, which in some cases might be great and it might be the right call, but in some cases might be a little bit too rash and
Mhm.
not necessarily right for the long-term value-based decision aspect of it.
Yes, I so agree. I mean, it's like what we were talking about earlier in the conversation, right? Of making these quick snapshot judgments that in the moment feel really good, but long term are not necessarily in alignment
Mm.
with our values. So that's why I'm a really big advocate of what we call wise mind, of integrating both the head and the heart in the decision making process. And that does mean we have to slow down, sleep on it for a night, sleep on it for a week. And unless it's something that really isn't going to impact your life too much, take the time to be really thoughtful about it. Consult with people who know you, love you, care about you, do your research on it, right? Really think it through, because again, like, these are big decisions that you may be making, and so you want to be thoughtful and mindful about it so that you're not just satisfied now, but you're going to be satisfied a week, a month, a year later with that choice.
And just as you were talking previously about things can be gradual and you can take a more gradual approach to re-engaging in your social life, you can take a gradual approach to making some of these decisions. And the decisions you make can be a bit more measured. They don't have to be so drastic. Just because we've been living in a pretty extreme situation doesn't mean you need to jump into a different extreme situation to counter what we've been living through for the past year plus.
Exactly, exactly. Take it day by day. I think we are going to see maybe a little bit of a leapfrog approach of just like jumping way far ahead or way far out. Take it bit by bit, take it bit by bit. And, I'm such a big advocate of gathering data. When you take it bit by bit, you can be a lot more mindful about the data that you're getting.
Yeah. And this isn't to dismiss people who are taking those big leapfrog approaches. For some people, that
Right.
might be the right approach. And if you're
Yeah.
saying, I want to do a 180, this isn't to discount that. Some people need that 180, and they've certainly had the time to reflect on whether that's a 180 that they want to take.
Right. Absolutely.
Lauren, are there any other things that you think people should consider? Some final thoughts for people to consider as we re-enter a semblance of normal life? Any things that people would find beneficial to hear that perhaps they haven't contemplated, or words that might make them feel a bit more comfortable?
Yeah. I mean, I don't think I'll be the first in saying this, but I think it's so important that we have self compassion for ourselves. I'm such a big fan of Kristen Neff's work on mindful self compassion and really just being kind to ourselves with this process. Like, we should just expect it's going to be a little uncomfy this year. It's going to be really freaking awkward this year sometimes, right? As we have new social gatherings and we don't know what to say. We've lost practice with that. So be kind to yourself, right? A lot of us are expecting to be able to run a mile, so to speak, when we haven't walked for a year. So be kind to yourself. And the other piece, too, we were talking about this earlier, be kind to other people, too. Like, I think it's so easy to jump to conclusions about someone or judge someone, but really slowing down and having empathy, especially for people who maybe you disagree with. If anything, I think a lot of us this year, we want to reconnect. And if we want to reconnect, it's got to include empathy in the picture. There's never going to be a person you 100% agree with. So having empathy for others, I think, is going to help us as we all get through this kind of sticky next year ahead.
Be kind to yourself and be kind to others. I like that.
But
Lauren, where can people learn more about you, your books, the course that you're doing?
yeah, absolutely. So the course actually launches next week. The cart opens, which I'm super excited for. So that'll be May 10th. And again, it's called Find Your Why, Know Your Way. It's all about helping millennials make values-based decisions, particularly in the context of their career. And I'm really excited with it because we're doing group coaching as well. I'm having expert panelists come on. It's going to be an amazing community of people. So I can't wait for that. And then also, if people are hearing this today and they want to bring me in to have me speak with their community or their team, I would love to do that, whether it's virtually or who knows, Zale, maybe in person. I don't know.
Maybe
You
don't
can,
get too crazy, but yeah.
I know. You can find me at drlaurencook.com, and happy to work with groups or also one-on-one coaching too.
And I'll put all that information in the episode notes. And this will probably air after your course, but I imagine you'll have other upcoming courses in the future as well, correct?
Yeah, and if people are really wanting to join, I think we can make it happen. So just send me a DM on Instagram at Dr. Lauren Cook. I'd be happy to support anybody listening today.
Well, Lauren, thank you so much for all your wonderful insights and perspectives. I think you've given people a lot to look forward to, some hope as they can maybe be a bit less intimidated and be a little bit more accepting of the challenges that await us with a positive outlook. So thank you so much for joining me.
Thanks, Sale, for having me. Have a good one.
And thank you everybody for listening to another episode of Preconceived. Have a great day.